Howdy, folks. For this sketch, we find ourselves back in the Wild West. It's a little eerie today, a little too quiet at these here macro cages. The perfect setting to talk about the non-tuberculous mycobacteria species. That is, all the mycobacteria species that don't cause tuberculosis or leprosy. We will review species within Mycobacterium avium complex, as well as Mycobacteria scrofulaceum and marinum. Wait, did you hear that? It's the acid-fast gunslinger. I guess since he's the quickest draw in town, we may as well jump right in with some general features of all the non-tuberculous mycobacteria species. We've met this man before, and just like all of our other encounters, his quick-draw fuchsia-colored gun is a reminder that the carbofuchsin stain detects acid-fast mycobacteria. The tassels of his cloak and chaps represent the mycolic acids that are present in Mycobacterium's cell wall, which are responsible for taking up the acid-fast stain. Like their brethren, the tuberculous mycobacteria, these non-tuberculous bacteria like to invade macrophages, represented by our recurring macrocage, and form granulomas. Without going too much into the pathophysiology and immunology, it's an important way these organisms escape detection from the immune system. Now, let's take a closer look behind bars. See this bird we've drawn inside the jail cell? It's our symbol for Mycobacterium avium complex, which is comprised of the species Mycobacterium avium and Mycobacterium intracellulare. The bird works as a symbol for both MAC and M. avium, while the fact that it's inside should remind you of intracellulare. MAC organisms were first identified in chickens in the late 1800s, but wasn't till about a half a century later that it was realized that they could infect humans, though human-to-human transmission is unlikely to occur. They're naturally found in dust, soil, and water, and infection spreads by inhalation, ingestion, or inoculation via the respiratory or GI tract. Now, for the clinical presentation. Like its tuberculous counterpart, MAC can affect the lungs. However, MAC tends to affect patients with pre-existing symptomatic pulmonary disease, like bronchiectasis or COPD, hence this pink puffer prisoner who's sporting a lung vest. To make things extra confusing, these patients will usually present with classic TB symptoms: cough, fatigue, night sweats, shortness of breath, and weight loss. Hey, he's getting away! Get after him before he disseminates! This escapee is a reminder that MAC doesn't always stay confined to the lungs and can cause disseminated disease. Localized infections spread from the respiratory and GI tracts to other organ systems via the lymphatics and blood. Our escapee is on crutches to remind us that disseminated disease typically occurs in immunocompromised patients, such as those with advanced HIV. In fact, it's actually considered an AIDS-defining condition. The symptoms are nonspecific and include fever, chills, night sweats, weight loss, and watery diarrhea. On exam, you may note hepatosplenomegaly and lymphadenopathy, and labs may show leukopenia, anemia, elevated alkaline phosphatase, and elevated lactate dehydrogenase. The final clinical manifestation of MAC is cervical lymphadenitis, but since this isn't something that is commonly tested, we didn't include it in our memory palace. But keep in mind that immunocompetent people are more likely to develop cervical lymphadenitis over disseminated disease. Uh-oh. It appears our gunslinging anti-hero has caught the sheriff's attention. And speaking of the sheriff, the ring of pill bottles that she's carrying is a reminder that MAC is often multi-drug resistant. Therefore, it's much less susceptible to the usual anti-tuberculosis drugs, so a combination of agents is used. Besides starting antiretroviral therapy in HIV patients, if they haven't started already, you'll want to give a typical combination: a macrolide such as clarithromycin or azithromycin plus ethambutol. Macrolides are represented by our recurring and ubiquitous macrolide crows, and you can remember our sheriff's name, Ethel, for ethambutol. If there is a high chance of multi-drug resistance, your patient does not respond to antiretroviral therapy, or has a high mycobacterial load, you can consider giving a third agent such as rifabutin. Rifabutin is related to rifampin, hence our rifampin rifle. let's hope this situation is treated well, and we can gallop off in peace. But before we do, let's go over just a few more things, such as prophylaxis. HIV patients who are not on ART and have a CD4 count less than 50 should receive a macrolide, like azithromycin, for prophylaxis against MAC, which is why this macrolide crow is sitting on a 50 miles per hour speed limit sign. Whew! These ponies must have a lot of horsepower. Okay. I promise not to tell you any more lame jokes in this sketch. So, let's wrap up this section by going over two non-tuberculous Mycobacterium species, Scrofulaceum and Marinum. Aw, look at this kid lifting up this puppy by his scruff. These cuties are our symbol for Mycobacterium scrofulaceum. This kid's a real pro at this, and is even able to lift up this puppy by just holding one side of the scruff. This should also help you remember that M. scrofulaceum causes unilateral cervical lymphadenitis in children. Lastly, we have Mycobacterium marinum, which can infect fish, amphibians, reptiles, and of course, humans. Over yonder, we have this horse trough filled with water, which should help you remember marinum. Since this water's all dirty, it shouldn't be surprising to you that marinum is spread by contaminated water. We also added a fish jumping out of the water to help you remember that aquarium fish tanks are usually the culprit, and can also spread to humans from infected animals, like fish. Oof, this one's a biter. Bad news for this guy is good news for us, as his red swollen hand should help us remember that M. marinum infections typically involve the skin, and test writers often mention an aquarium handler who presents with a hand infection. They may even be talking about this exact guy. Well, that's it for now. See? I told you the Wild West doesn't stay quiet for long. So, until the next adventure.